Orthopedic surgeons have been using cortisone injections for years, I mean decades really, probably 30, 40 years, to treat all kinds of conditions. It could be arthritis of the knee, it could be rotator cuff impingement of the shoulder, it could be, a problem like tennis elbow. There's a number of different things that we try, cortisone injections for. But in recent years, we've decided, generally, this is not absolutely across the board, but a lot of orthopedic surgeons have grown a little more weary of using cortisone injections, especially just doing shot after shot for a number of different treatments. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of injuries, injury treatments, and injury prevention, in sports and exercise for athletes and active people, probably much like yourself, so that you can stay your best. In this Ask Dr. Geyer video, I want to talk about cortisone injections, as it pertains to their role in a really common problem of the elbow, and that's tennis elbow. Okay, Chris asks, if cortisone is more for pain relief, then in essence, it's not promoting healing. For tennis elbow, would it be better to look at injections with a medicine to promote the healing process? Also, if this is an option, what kind of medicinal injections are available? Well, that's a terrific question that Chris asks, and it gets to the nature of what cortisone actually does. First of all, cortisone is a generic term. It's a corticosteroid, not a steroid in the anabolic steroid sense, but a steroid that's essentially an anti-inflammatory, very much like your Advils and Aleve that you take. Those are non-steroidal anti-inflammatories. This is a steroid that is an anti-inflammatory. But instead of taking it by mouth so it gets all throughout the body, you're injecting it into a particular area of the body to deliver an anti-inflammatory effect, in theory, directly into that area. And it is thought for a number of different problems to provide a great deal of pain relief. Now, the question is, does it actually treat the underlying problem? We know that for a problem like knee arthritis, it has no effect on actually making the cartilage damage go away. Now, tennis elbow, and we've talked about this in a number of different Ask Dr. Geyer posts and even some of these videos, that's a disease process of the outside of the elbow, the lateral side of the elbow. It's called lateral epicondylitis. But it's actually not an inflammation of the tendons that extend your wrist. It's sort of an area of intrinsic degeneration within one of those tendons. And so the problem with cortisone and why we've really gotten away from it for tennis elbow is that as an anti-inflammatory, there's no inflammatories in there for it to work. So very often, yes, it can decrease pain, short term, but we've seen with studies over and over the last few years, we actually think patients have a higher chance that it comes back, what we mean by a higher recurrence rate. And so sometimes we'll use it maybe once, but I think we've really gotten away from doing it over and over and over again to treat tennis elbow. I think the first line of treatments for lateral epicondylitis are still things like physical therapy and stretching exercise, sometimes the counterforce straps that you wear on the forearm just below your elbow, and a lot of times that's enough to get it better. Occasionally, when that gets people better but it doesn't get them over the hump, maybe a cortisone injection can be a decent idea. But what Chris is asking about, are there medicines that can potentially improve the disease process? What we at least think about with lateral epicondylitis or tennis elbow is a medicine or injection potentially that does get that area of tendon degeneration to heal. The main one that we've been trying is platelet-rich plasma. Now that's an injection. It's in the category of treatments that we call orthobiologics. Basically, the orthopedic surgeon draws a small syringe of blood, basically like anytime you give blood, as far as giving labs, not donating blood, but a small amount of blood. The surgeon puts it in a centrifuge to spin it, and that separates out the white blood cells and the red blood cells. You take those out, and what you're left with is the plasma. And in that plasma, you've got platelets, hence platelet-rich plasma, but in those platelets, you've also got growth factors that in theory, then basically you inject that plasma with the platelets and their growth factors, and basically the platelets open up, they release their growth factors, and that stimulates an inflammatory reaction. That inflammation becomes fibrous tissue and in theory ultimately becomes new collagen, at least in the case of tennis elbow. So in theory, you're trying to get that tendon area to heal. Now, there have been some different studies on it, and there's some differing opinions on platelet-rich plasma, but for tennis elbow, a lot of studies show that it at least has good results. Now, the trick with platelet-rich plasma, a few things. One, you don't know that it's going to work, much like cortisone, but there's not that much of a downside other than some just discomfort at the area of injection. But like I said, there's a chance that it doesn't work. The other problem with platelet-rich plasma is that very often, almost always actually, insurance doesn't pay for it, and so the patient often has to pay cash. Now, in today's climate of insurance and high deductibles, a lot of times people are having to meet deductibles anyway, so these injections, even cortisone, they're having to pay a lot of times out of pocket, but you're going to be paying anywhere from $200, $250. Some places charge as high as $700, $800 for platelet-rich plasma. So it's important to discuss not just the diagnosis, lateral epicondylitis, but the treatment options potentially, not just cortisone injections, but platelet-rich plasma, and then potentially the success rates, complication rates, potential costs. It's one thing to at least try, because Chris is right, we are, for a lot of problems, not just tennis elbow, trying to get away from cortisone injections. Okay, what do you think? Have you had a cortisone injection for tennis elbow, and did it work? I mean, how likely or how quickly, if at all, did your symptoms come back, or did that really take care of the problem? I'd love to hear your thoughts. So below this video, let me know your experiences. I'd love to read them, and I'm sure other viewers would be curious on what you have to say as well. And if you know people dealing with tennis elbow, I'd really appreciate it if you would share this video with him or her, so hopefully that it can make a difference and help him or her decide possible treatments that he or she might want to try. Now, if you like videos like this and you want more information on injuries, injury treatments, and injury prevention in all types of sports and exercise, subscribe to my video channel. I record a couple of these videos every single week, and I would absolutely love to deliver those directly to you. And finally, there's so many resources that I create on ways to stay healthy and perform your best that I only share with my email list. So go to my website, drdavidgeyer.com. At the very top of the page, you can enter your name and your email. It's completely free, and I'll deliver those resources directly to you. I'd love to connect with you that way as well. Thank you so much for watching. I'd love to hear your experience. If you've had tennis elbow, I'd love to hear what you've tried and if it worked. And remember to subscribe to my video channel. I look forward to seeing you right here next time.